As Dr. Davila will detail, we now have a new challenge in front of us, which is 200,000 kids between the ages of 5 to 11 who live in our city. They aren't eligible to be vaccinated yet, but that day is soon to come. While we are still awaiting Health Canada approval of the COVID-19 vaccine for kids, we are doing all of the work we need to do so that we're ready when the time comes to help deliver these vaccinations. We're in the process now of planning clinics across the city, including school clinics, in partnership with the school boards and at family doctors and pediatricians' offices. Our kids' clinics will include superhero selfie stations to make the experience fun and comfortable for kids. We want them to feel like they're superheroes in getting vaccinated, because they are. And we want to make sure that they experience it in that way as kids would, and that the experience is a very positive and fun one for them. We're also planning many other clinics to help make the vaccine as easily accessible as possible. We've talked about we all want this pandemic to come to an end, but it can't end if kids aren't protected.
It's true that in general, children have a much lower risk of severe outcomes and hospitalization compared to adults after contracting COVID-19, even when exposed to the Delta variant. However, children in Toronto, specifically 4 to 13-year-olds, currently have the highest reported case rate out of any other age group in the city, and they have had since late this summer. And while severe outcomes for children are rare, they do happen. All over the world, children have been hospitalized, treated in the ICU, and tragically, some have died as a result of COVID-19 infection.